A pattern I keep seeing again and again is a patient who has already collected 3 or 4 separate diagnoses like anxiety, sinusitis, maybe SIBO or an autoimmune label. And every time they see a specialist, they are treated as separate problems altogether. Their conventional labs also often come back within normal ranges. And if mold has been a part of their story, either it's been removed or it hasn't, but they're still not recovering predictably. What tends to get missed is that these diagnoses are not separate events. They are the same terrain and immune disruption problem expressing themselves through whichever system crosses a threshold first. That sequence is readable, it's predictable, and once you see it, diagnoses associated with mold or not start to be a lot less confusing. I'm Dr. Kenny, an IFM certified functional medicine practitioner. Let's dive into this exact underlying chemistry pattern. Most people who end up in my practice with a mold-related history did not skip doing the work and asking the questions. In fact, they've usually seen 10 to 15 different practitioners before they come and see me. They found the source, maybe they got tested, both the home and themselves. Some of them even receive a label called CIRS. This is chronic inflammatory response syndrome. This is the clinical framework that describes what mold and other water-damaged building exposures can do to the immune and the nervous system over time. They maybe ran the binders, the IV drips, the mold protocols, and maybe even moved in some cases, and yet they're still hitting walls in their healing journeys. Those walls are what I want to talk about today, because there's a version of mold education out there that ends at the exposure. It's like the questioning stops altogether. It tells you what mold can do. It lists the symptoms, the cluster categories, the inflammation. I've done several of these videos myself. And that information is real, but it answers a different question altogether than the one your body is actually asking underneath when it hits these walls. Knowing that mold can cause your symptoms is not the same as understanding why your system responded the way it did, or why it hasn't been able to reset. Those are two different lenses, and treating them as the same is where a lot of healing stalls. The Shoemaker cluster framework is something you may have come across as well. These are the symptom categories that are used to evaluate CIRS. And it gets presented to patients sometimes as a matching exercise, just like many other screening protocols we have out there. You read the list, you identify which symptoms you may be experiencing, and the match becomes the diagnosis. It gives scattered symptoms a frame for us to start talking about, and it validates that these things are connected for many people. But the list doesn't explain why your cluster may look so different from somebody else living in the same household or the same building. Two people in the same water-damaged office or apartment with the same duration and exposure may have completely different symptoms. Some in the brain category, some in the joint and fatigue category, others in chemical sensitivities. Everything from perfumes to cleaning products that never used to bother them before. The exposure was the same, but the biology that is expressed responded differently. What determines the pattern that is expressed is not primarily the toxin, and that shocks some people. It is the terrain of the individual, the sum of that person's lived experiences, like their immune system history, their hormone backdrop, their HLA genetics. These are the genetic variants that affect how the immune system recognizes and clears certain biotoxins, like those mycotoxins. Also, their mitochondrial reserve or their autonomic or rest and digest nervous system baseline. It all has to do with the load they were carrying before mold entered the picture. Recent research in Twitter showed that patients with the HLA gene variant were eliminating the mycotoxins for 18 months plus after their exposure even stopped. And what this tells us is that this genetic subset of people cannot clear mycotoxins normally. And that's incredibly important for symptom resolution, obviously. So this talks to the complexity and the uniqueness and the individuality that comes into play when we're talking about ridding yourself of mycotoxins. So a symptom cluster that you may experience is not just a record of what the mold has affected. It's a map of which systems in your life likely need the most support because the capacity tipped before mold came into the picture. For many people, understanding loss of immune tolerance And this reframe changes everything about the clinical work that they do next. So let's talk about the mechanisms that explain the hitting of the healing wall, if you will. You may have come across other videos where I talked about things like mast cell activation syndrome and this loss of tolerance, and the thermostat reference or analogy. Imagine that your nervous system and your immune system are this thermostat. The job of these systems to assess the current state, things like whether or not it's threatening or safe, how's the rest and repair, how's the demand, and it regulates your body's responses accordingly. When threats pass, the thermostat reads that change and usually turns off the heat or turns off the air accordingly when it reaches that level set point. Your system essentially is shifting from that fight or flight mode into the rest and digest mode. That shift is not optional. It is required for healing to be able to take place because recovery happens in that parasympathetic or rest and digest state. Immune regulation, hormone signaling and balance, tissue repair, all of it requires that your system actually gets there. But imagine that feedback wire of your thermostat is cut or damaged. The thermostat may still be running in the opposite direction. It's still producing heat and cold, but it's lost the ability to read the temperature of the room and adjust accordingly. That's exactly what's happening here in this circumstance. When it comes to mycotoxins and the way they leave lasting impressions in these systems in our bodies, these are the most important things to turn your focus to. Essentially, it stays in activation because the normal mechanism that returns you back to baseline, that tells this whole process to stop, has been compromised. This is what prolonged mycotoxin load can do. Mycotoxins are the toxic byproducts produced by certain mold species. The load doesn't just stress out your nervous system and affect your immune system. It degrades this switching mechanism itself from fight or flight to rest and digest. And that is a structurally different problem than simply having too much stress or simply just removing mold toxins from the body. This is why many patients going through this rightfully roll their eyes when somebody just suggests a little more sleep, hygiene, or similar, like stress reduction, because they don't move the needle in the way that they should or as predictably for these patients. It's not that these interventions are wrong by any means. I consider them safety signals that we're trying to send your system. But your system has essentially lost the ability to switch between this fight or flight state and this more healing and reparative state. The wire's been cut, if you will. And you cannot just coach or mindset your way through that rest and repair process for many people when the signaling mechanism is disrupted. What complicates the process of healing from mold and mycotoxins further goes along with some recent research that was found in 2024. It showed that mycotoxins produced by common mold species, including Aspergillus and Penicillium, activates microglia in cell culture. These are cells in your brain, and this essentially supports the nervous system or inflammatory mechanism for mycotoxins affecting our nervous system. This has implications beyond the nervous system we have control over, like your rest and digest nervous system. It's important to note that this was a cell study, but even cell studies can help to point us in the right direction of underlying chemistry mechanisms when we talk about chronic disease, especially. The patients who often confuse clinicians the most are the ones who are literally doing everything right. They're documenting their exposures and maybe even removing mold from their homes or dialing in their sleep and their food and their exercise, even running the detailed and costly labs that look at mycotoxins, and they're still not recovering for months or years. From the outside, this looks like a mystery, but from a systems-based functional medicine perspective, it makes a lot of sense. There's a threshold in this process and a mechanism that just does not get named or factored in clearly enough. Early in the mold illness picture, the inflammatory response starts generally proportional in most people. The body's reacting to a real load, the load is reduced or it changes, or the body has enough power behind it to overcome. But when that load persists for long enough, including the rest of the triggers of stress chemistry, whether we're talking about poor diet or poor sleep or stress at home or at work, These are all things that cause that threshold to shift. The immune system, your autonomic nervous system, even your mitochondria, they have reorganized around this dysfunction. And that feedback loop that normally returns you back to quote unquote normal is now cycling in a way that sustains the activation state instead of the healing state. This is what I call the terrain reset problem. The mold may have been the trigger, but it's left a lasting impression in your terrain and your chemistry. And the clinical picture in front of you after the mold is not about the mold anymore. It's about a system that's lost its capacity to find its way back to that thermostat set point. And I see this pattern most in people who were extraordinarily high functioning, maybe even in the corporate world, or high performing mothers. And the mold exposure really tipped the scale in their resilience, sometimes having to take months or even years off of work. Their own history makes the deterioration itself very disorienting because they were so high performing, and the contrast doesn't often make sense. But what's often happened in the background is they've probably been powering through for years, and then that threshold was reached. If this description lands for you somewhere specifically, I would love to know what that moment may have looked like for you. Maybe hindsight 2020, or if you're going through it now, what was your trigger, or how was the stage possibly set in your nervous and immune system that added to the burden of mold toxins? Drop it in the comments below. It'll help people following along maybe see some of their story in yours. Another finding that comes alongside mold-related illness that I want to flag specifically is what's called multiple chemical sensitivity, or MCS. This is a pattern where people become more reactive to smells, chemicals, environmental exposures that never used to affect them before. This can even tip the scale into food sensitivities and beyond. So fragrances, cleaning products, vehicle exhaust, cigarette smoke, preservatives, these are all things that activate the system further when that threshold has been reached. This often gets mentioned as a downstream symptom of mold illness, but what it often is a signal deeper about tolerance in the immune and nervous system at large. To be more specific about tolerance, this is your system's capacity to process and adapt to various inputs, whether they're food or environment or stress, without triggering an inflammatory cascade. Your body is, yes, supposed to respond when there's a threat, but it's also supposed to not respond when there's not a threat. A 2023 study involving 44 MCAS patients showed that mold toxins play a role in sensitizing the immune system and reducing that threshold for immune tolerance. And it also leads to situations of chemical reactivity associated with MCAS, but also with mold-related illness. That's also an important part of the nervous system. When tolerance breaks down, that threshold to reactivity drops, sometimes all the way to the floor for people. I was just talking to a patient today who had half a walnut and it triggered her experience. Things the system used to handle with worry at all are now read as threats. When I see multiple chemical sensitivity in a patient's picture, it doesn't tell me that the patient somehow is just sensitive, which comes up in many conventional and even holistic visits. It tells me where they were in their progression and a little bit about their backdrop of perhaps genetic potential for clearing as well. The nervous system, the hormone signaling, the HLA piece, the immune set point, these are all operating at the edge capacity. And that changes the sequence of what often needs to be supported first. If you go after the mycotoxins right away in this state, it can make things worse. I want to say something specific about cognitive symptoms too, because they're the ones that are most often underestimated and underappreciated. I hear my patients suffering through these all the time. Patients describe it in different ways too. Fog is the common word, but that sometimes undersells it. For some people, this can be a functional loss that resembles what happens after head injury even, or traumatic brain injury. For others, even executive function or retrieving words or their working memory are affected, and they're unable to execute even common work tasks. Many have to take time off of work. Part of the mechanism for this when it comes to mold illness is what researchers call your glymphatic system. your brain's waste clearing system, if you will. Think of it as the drainage network that runs primarily during sleep. So if your sleep is disrupted, your glymphatic system is likely disrupted. And it flushes out the byproducts of the chemical reactions that accumulate during the day beyond this blood-brain barrier. That clearance process really heavily relies on your rest and digest nervous system piece to operate efficiently. So when your autonomic or automatic nervous system, the one that we don't think of, is stuck in the more fight or flight side of that nervous system, that drainage is compromised. Waste that should be cleared during sleep cleanly accumulates instead, and this drives many of those profound cognitive symptoms. This isn't the only mechanism at play, but it is one that is clinically documented and incredibly important to consider. So now let's talk about a clinical workup. Obviously, mold toxins have the ability to affect almost every symptom in the body. Mold testing, like standard mycotoxin panels in your urine, answer one part of the question. How much are you clearing? And was there exposure? And is there evidence of an ongoing burden inside the body? That is a good starting point, but it's not necessarily a map for the rest of this picture. The workup should also address how mold exposure has affected other body systems, from the nervous and immune system to even your mitochondrial function. This is where your energy is produced inside of your cells, and it depends on smooth running systems to clearly create enough clean energy. And part of a really good functional medicine workup is also getting a snapshot into the patient's lived experiences up until the point that everything changed, because that gives you a deep understanding of how your systems may have been primed to react the way that they have. Many times when mold illness enters the conversation, we're still living in the mold and mycotoxin exposure or clearance language. And while that is very important, the symptoms can linger because the systems were not addressed underneath. And that's what systems biology and functional medicine is all about, understanding that terrain much deeper. We can look at things like detailed hormone panels, such as the Dutch test, or mitochondria with an organic acids test, and start putting the pieces together. Because as long as one of those disruptions lingers, symptom resolution becomes a lot less predictable. If this approach is resonating with you as well, and you're in one of the states that I practice in, check out the free training below, which prepares you for a health mystery map call to see if the way that I do functional medicine matches up with what your body is looking for. There is a specific piece of this investigation that we haven't really touched in detail yet in this video: how mold affects your mitochondria directly and the implications that that has body-wide. So if that's something that interests you, check out this next video right here. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next one.